With Niall Dickson, who's the co-chair of the Brexit Health Alliance, a lobby group bringing together the NHS, the medical research industry and public health organisations. He's in our Edinburgh studio. And Niall, a very good afternoon to you. Thanks for joining us. What do you make of what you've heard so far? Any reassurances there for you?
Yes, I think there is an element of reassurance here. The government clearly is hoping for the best, but has recognised that it must plan for the worst. And there is no doubt that in the area, for example, in the supply of medicines, it does present a really very serious risk. We will be in unprecedented territory. But the guidance that's coming out today, admittedly quite high level, but starting to say, for example, that we will need 6 weeks of stockpiles of every medicine, that where medicines have a short shelf life, we'll need to arrange the potential of having air freight transport to avoid any blockages which there may be at the border. All these seem really very sensible measures, and our members from the pharmaceutical industry and the other parts of industry, as well as the NHS, have been working with the government to develop this. That said, I think there's quite a lot more detail, both on the pharmaceutical side, still to be worked through, as well as with the NHS itself, so that hospitals and other parts of the NHS are able to plan effectively. I think the other point just to make, which is that the guidance is pretty clear that ordinary, on-the-ground organisations within the NHS and indeed patients do not need to stockpile. So we don't want people panicking. I think the message from the centre is a wise one. If we get the planning right, we should be able to avoid problems, and stockpiling at a local level is not the answer. But national stockpiling does make sense.
Because the point you've been making, and you've been saying this morning in other interviews, I know, that if the planning isn't right, patients' lives could be at risk. Where do you stand on that now?
Well, that still absolutely applies, and I think the government recognises that as well. That is why they're putting in place this fairly comprehensive and unprecedented series of measures. Everybody is hoping that these measures do not have to be put into place. But it is clear we don't know exactly how the European Union will behave, as it were, if there is no deal. We will say, of course, yes, we'll accept your products and so forth, but we don't know what the situation will be like at the borders. And it may be fine if you leave some cars sitting on the border for a few days. It's not fine if you leave medicines.
Is the lead-up time, though, enough if it turns out there isn't a deal? Is the lead-up time sufficient to get this sorted out, to build up the stockpiles that you're talking about, etc.?
Well, certainly I haven't heard anyone say, no, we haven't got enough time, it's too late now. But I think now is the time to get on with it, as it were. We have been urging the government for a considerable period of time to start really being public about the no-deal scenario, and we're very pleased that they've done that. But I think it would be wrong to say, no, this can't be done in that time. I think it almost certainly can be done. We just need to get on with that, and we need to get more detailed operational guidance coming from NHS England and probably from the devolved administrations throughout the UK as well, to support individual organisations at local level to make sure that they have got everything set up. I mean, it is worth noting that if you have an operation today, it's possible that some of the materials that are used in your operation will have been delivered the day before to that hospital. That just-in-time type of supply chain is how the healthcare system now works, like any other industry.
OK, Niall, thank you very much for your time today. Niall Dickson, co-chair of the Brexit Health